Thank you very much, Anil. It's very, very lovely to reconnect after some quite a few years, and hope that we don't have to wait 8 more years to connect again. A very big thank you to Namrata and to the School of Public Policy at the IIM Ahmedabad for inviting me to this very important conversation. In fact, at the start of the chaos of these last 20 months, back in April and May 2020, colleagues at CPR who work on international relations, and many of us are very deeply committed to rebuilding South Asian regionalism, something that I think tends to has increasingly now actually just got caught in the geopolitical wars within the region, and we thought, we felt that perhaps COVID was an important opportunity to find ways of rebuilding bridges and bringing our nations together as we collectively struggle to respond to what was a global problem. And it's always, I think, I really think that India has lost out on much that India could learn from our neighbors on how to respond, how to build health systems, and how to respond to crises. And our failure to engage in a dialogue at the political level is, I think, I don't think India recognizes how much India loses by failing to do so, and also failing to acknowledge that there's a lot that we need to learn from our neighbors. At a people-to-people level, we did initiate some conversations through various groupings, but I guess that the interesting thing about the challenge of COVID is, at one level, it was a reminder of how deeply interconnected our everyday lives are within the region and across the globe. And yet our responses have been very much to look inward, closing off our borders, and in some ways rebuilding the relationship between citizens and the nation state almost in sort of complete reaction to the fact that this was a pandemic precisely because we were so deeply integrated. And I think overall, even now, if you as we are towards hopefully a new cycle of the pandemic, one that is going to convert this into something that is more endemic, and we are talking about vaccines and medication. The fears of the pandemic are hopefully somewhat behind us, or the worst of the pandemic is somewhat behind us. It is astonishing how little global institutions, multilateral institutions of global governance have been able to mobilize in meaningful ways to address the pandemic. So I think opportunities like this to really bring us together as a region to debate and discuss how we have individually as countries responded to the pandemic, what we can learn from each other, hopefully is a starting point for us as a citizenry of the region to push our respective governments to reimagine what regional cooperation should be about, and to recognize the importance of cross-border engagements and rebuilding a stronger sense of regionalism, one that finds ways around the geopolitical challenges, the security challenges that this region confronts, and one that actually builds on the deep historical and people-to-people connections that we have. So it's a real privilege for me to be here. And in that context, I felt that it would be important for me, I am only qualified to tell you the India story, but I wanted to be as candid and frank about the India story as I could be, because I think that there are many similarities. I think many countries made similar mistakes, struggled with similar forms of uncertainties, had very similar questions, and we didn't effectively learn from each other. The only way that we can address this is to be truly candid about the realities that we confront, and explore whether there are ways in which we can collectively find solutions to what are in fact global problems, even though regional challenges, even though they unfold in our nations in very different ways. So what I thought I would do through the course of my talk was to reflect a little bit on what I see as the big fault lines that COVID-19 and the Indian state, and by state, I'm not, when we talk about India, there is a national government and then there are state governments, and health, social protection, all of which are critical aspects to the COVID-19 experience and governmental response, are essentially state subjects, and then the center played an important role. So there have been lots of tug of wars between the two. So I'm thinking of the Indian state as, talking of the Indian state both as a central government and the state government, and I'll refer to each one of them separately on different occasions because they did play different roles, and had differential kinds of impact. But essentially, I think that COVID, the COVID-19 experience of these last 21 months have in more ways than one exposed pre-existing fault lines, and really shown the mirror to us as a society, as a polity, and of particularly in terms of how the citizen state social contract has been forged. And I will end on a somewhat depressing note by saying that, in fact, even as these fault lines have been exposed in the most violent of ways, in some senses, with the most lethal of consequences, our ability, both as a state and a citizenry, to learn from this and forge a new consensus is extremely limited. And that's really the challenge, I think, for India today. And again, here I would like to emphasize that I think that there's a lot that we can learn from our neighbors and from the region. So I'm going to talk about three key fault lines that I think were highlighted through the course of these last 20 months. The first, and I think the most crucial, is the fault line of citizenship. COVID-19 in March 2020 unfolded against the backdrop of significant global concern and global chaos. Nowhere in the world did we know how to respond and react to this completely unknown challenge that we confronted. And across the globe, it seemed almost that as the challenge of COVID became visible, that the panic that it unfolded across the world, that citizens across the globe were somewhat comfortable with bring the state into their everyday lives in ways that curbed basic liberties, freedom of movement, freedom of all in the expectation of the state being the most critical player in being able to respond to the challenge of the pandemic. So even in the Western world, and you see these debates continue to unfold, particularly in the US, and I think Anil will be able to tell us a lot more about that too. The well-accepted limits of state power was suddenly opened up, and it became legitimate for the state to use fairly coercive measures of surveillance to unleash its power on citizens in the effort to to respond to the COVID pandemic. And at that point, I think India faced a very important choice. It faced an important choice in terms of what would be the appropriate way forward for India to respond to the pandemic. The globe, against the shadow of COVID-19, was moving in the direction, at least for the near term, of lockdowns and trying to contain the disease while it expanded its health system, and the role of surveillance became a very, very crucial piece in this puzzle. And what is interesting about India is that in that phase of March 2020, in response to the panic that was necessarily unleashed as a consequence of the unknowns that we confronted, the Indian state and the Indian elite consensus around the lockdown was extremely strong. It is still surprising to me 20 months later that we didn't stop for one moment I'm talking about, Parliament was in session at the time in March 2020, and I remember across political parties, politicians urging the government to take far-reaching and fast steps. Our refusal to lock down, or our slowness in locking down. At that point, we had 500 known cases of COVID in the country, or even less. Yet the fact that the Prime Minister was not moving in the direction of a lockdown became a matter of political debate in Parliament. Never once did we ask what would happen to the vast majority of India when you switch the button of the economy off. Not once. And even today, while we argue about the sudden lockdown, the lockdown in less than 4 hours, the lack of preparedness, we are unwilling to question whether that was the appropriate move as an elite for the country, despite having witnessed, sitting in the comforts of our homes, on our televisions, the ravages of COVID and what that lockdown unleashed on much of the Indian economy. And if you did a quick survey of newspaper op-ed articles in those first 2 months, there was almost a modicum of surprise. Most Indian workers do not have enough savings to be able to not work for more than 2 weeks. Inside government, it's not like bureaucrats and politicians are unaware of these realities. In fact, there was a committee on migration, that were migrant workers, that was set up in 2015 to figure out how to build a robust social safety net for migrant workers. We recognized that India was moving and that migrant worker, internal migration was a crucial source of labor and a crucial form of livelihood for that labor across the country. And yet there was no urgency to the recommendations of that report. In fact, one of my colleagues at CPR was a member of that committee. So it's not that the challenge was unknown. It is that the challenge was not at the front and center of our minds as we took the kinds of decisions that we took, and as we forged this elite consensus around what steps we needed to take. Importantly, India actually, for how broken our health system is, actually does have some good experiences with responding to pandemics, endemics, not at the scale of COVID, of course, but India has dealt with H1N1, India has dealt with Zika virus. There are states in India, Kerala is a good example, but even Rajasthan, that over the course of responding to these kinds of zoonotic diseases that are beginning to now become crucial public health problems, we have built up some expertise. What is important is that expertise never found voice in the early decision making that we took in those crucial 2 months. So I think the first sort of fault line that COVID exposed for me was the extent to which the elite consensus is divorced from or refuses to acknowledge the everyday realities of the vast real economy of India. And it doesn't always engage in a reflexive discourse on what needs to be done effectively to address that. What was equally interesting within days of the lockdown was the extent to which of the national lockdown, the extent to which an attempt was made to politically mobilize the elite around the lockdown and around the COVID response. For those of you who are in India, many of you will recall the first trial lockdown. There was one Sunday when we were all locked in, and the Prime Minister came on national television urging us to bang our thalis and in support of the frontline workers, in support of COVID patients. A few days later, we were all met for a few minutes on one Sunday evening. We switched off our lights, put on our mobile phones, lit candles, and rather bizarrely in Delhi, lots of firecrackers were also raised, which I still haven't quite got to the nub of, but we like our firecrackers despite pollution, so I suppose this was a good opportunity to burst them. A few weeks after that, our military, navy, our commanding forces had helicopters going through the city, dropping rose petals on key hospitals, all by by the way, at a time when COVID cases compared to what we experienced exactly 1 year later were far lower. And I'll come to what happened a year later in a few minutes. So there was an attempt at building a kind of political mobilization around the challenge that we confronted. But what we never really effectively spoke about was another kind of mobilization that was taking place all across our city, while the middle classes and the elites in our homes were switching off our lights and lighting candles, and frontline workers had rose petals being dropped on them. The bulk of India's workers were reaching borders of the cities to which they had migrated to, searching desperately for any means of transportation to go home. The state had told all Indians to stay home for 21 days. This was to be a 21-day battle. Do not cross the Lakshman Rekha of your home. The state also said, we look after you as a sort of add-on to what was being asked of all of our citizenry. But knowing the fact that the state had long abandoned them, and that's not a political point, knowing that the state had long abandoned them across many decades, India's workers knew that the only way that they could protect themselves and restore their own rights and dignity was by finding a way to go back home. And when all forms of transportation finished, were put to a stop, they walked home. The emblematic picture of India's national lockdown was those very difficult months of April and May, when the bulk of India's workers took to the highways as all transportation stopped and walked all the way, sometimes over hundreds of kilometers, to make their way home, because home was where they would be protected against the ravages of an unknown disease and against the ravages of an uncaring, callous state. What was described as an act of desperation by our political class, I interpret as an act of power, as a form of mobilization that spoke its voice to the state, making itself visible, telling the state that we, in fact, and as it turned out quite rightly so, do not trust your ability to look after us in our moment of crisis, or in this moment of national crisis. We will go back to our core social security, which is our home, our land, and that's where the bulk of India's workers still today have gone. The Indian state's callousness in its response was visible both in the fact that it did very little to provide relief even to those workers that were walking home. It took the better half of 3 to 3.5 weeks to mobilize transportation to ensure that migrant workers who wanted to go home. Very few arrangements were made for those who were walking home, and it was visible on our TV screens. This was not hidden away, to provide them with food and shelter on their through the long walk home. But what was even more important was how little political mobilization there was around this issue. For the first time, in some ways, India's workers made themselves visible to the nation. And the nation's political response was mostly to stay put in their homes and wait to see how the next few months would unfold. It did certainly lead to some recognition of the fact that urban India has very few forms of social protection. It did lead to some dialogue about the need for expanding the net of social safety nets to urban India. The government announced with great gusto 2 important things. One, eventually, it took us again 3 weeks before this, or 4 weeks before this announcement was made, that the free ration scheme would be extended to migrant workers. So you could receive ration regardless of whether you were able to produce a ration card. And I'll come to that in a moment, we had other issues there. And they announced the implementation of what they call a One Nation, One Ration Card program, where they would ensure portability to all workers so that they could access their entitlements and rights regardless of where they were located. Even today, this scheme is not effectively implemented. One of the important things about those 2 months was that in late April, early May, the government of India announced a series of measures for a relief package. It's well known that that relief package was not a particularly generous one, but regardless, the relief package included some amount of cash transfer, free ration, the National Rural Employment Guarantee Act, which is providing work in rural India, Surveys of the implementation of this program tell us a very important reality about India's social safety net. 85% of rural households, this is a paper done by Bhattacharya and co-authors of the World Bank, who did a survey to understand the extent to which these Pradhan Mantri Garib Kalyan Yojana was the name of the scheme, the PMJKY benefits reached. 85% of rural households received at least one benefit through this period, but a mere 25% of urban households reported receiving these benefits. The reality is that India's social protection network is robust to a degree in rural India, but extremely thin in urban India. A few state governments, Jharkhand and Orissa, two notable state governments who've tried this, Tamil Nadu is contemplating this as well, explored the possibility of launching urban employment guarantee programs along the lines of the rural employment guarantee program. But state finances have been limited. And again, that's something I'll come to a little later in our conversation. 1.5 years after that, those very difficult months of April and May 2020, we still don't have a national discourse and definitely don't have a political discourse on what needs to be done around social protection for India's migrant workers. We have a very robust national and political discourse on labor reform, but that labor reform dialogue is focusing very much on deregulation and not talking about social security. So the real challenge that India confronted through those 2-3 months remain a challenge that we have refused in our policy discourse or our political discourse to effectively acknowledge. Related to this is the fact that we still don't have good data to be able to answer the fundamental question that most economists are wondering about. Has labor moved back to the cities now that the economy has opened up? In fact, we are seeing government revenues are looking good. Many government economists are suggesting that we have gone through, the worst is over. The Indian economy is on a strong path to recovery. We will reach pre-pandemic levels before the end of the financial year. Central government revenues look stronger today in terms of the budgeted revenues that they were expecting to get than, according to a Credit Suisse analysis, than even 10 years ago. So the formal economy is looking strong. This is perhaps a consequence of pent-up demand of people like me spending and now that the economy has opened up, and that is having a consequence on government revenues. But we still don't have a good enough answer from government data on what is happening to the labor market across in the informal economy, and on whether or not rural migrant labor is moving back to urban India, back to jobs which pay 2.5x times more than rural wages. We still don't know from any government source. We have some private surveys that are giving us some indication, and those private surveys indicate that a lot of rural labor is still staying put in rural India. Another sign of the extent to which this trend is continuing is in the demand for the National Rural Employment Guarantee, NREGA or MNREGA work demand. Work demand is a little lower this quarter or first 2 quarters of the financial year than it was last year when the economy was completely at a standstill, but it is significantly higher than demand for work was in 2019, when, mind you, the Indian economy was still slowing down. So even that may not be a good enough indicator of what business as usual for the Indian economy should be like. All this suggests 2 very important things about our broken social contract. Despite the fact that India's workers sought to make themselves visible, restoring their rights and dignity in those difficult months of April and May, the Indian state still chooses not to recognize these workers or to work hard to make them and their everyday lives visible to the state in order to design policy. And our politics has completely abandoned the workers. It talks about labor reform and ease of business, but it doesn't talk effectively about social security that is core and crucial. A second aspect of this is what's happening to India's education system. Indian schools in India were the first to close, and they are now the last to open. I'm the mother of 2 small primary school going children. My children saw school on the 10th of March 2020 and haven't been inside their school buildings since. They have full access to online learning. They sit in class. for 2 hours every single day, I can tell from my 4th grader and 1st grader the extent of learning loss and psychological impact and emotional impact this is having. And my children have the best of everything. They have access to many things, yet they are suffering. One can only imagine what the reality of the bulk of India's primary school going children looks like today. Again, Government of India is only now doing a survey today. Friday was when the National Assessment Survey is going to be done in schools, as they have begun now to slowly open up from the 1st of November to assess the extent of learning loss. Private surveys are telling us that the learning loss is in fact significant. A survey by Aiyar in Karnataka showed us that there has been a 15% drop off in learning levels of reading capabilities of students in Standard 5, their ability to read a Standard 2 text, a 12% drop in their ability to do basic mathematics. Mind you, these drops may not seem as dramatic, but mind you, we are talking of a really low base of only about 50% on average nationally, children in Standard 5 being able to read a Standard 2 text. We know from studies of education across the globe that even a short period of closure of schools over a 2 to 3 week period can have long-term impacts on students' learning ability. What is critical about this are 2 crucial things. One, that we, honest to God, do not have a plan. Now in November, schools are beginning to open, primary schools are finally beginning to open, but we do not have a clearly articulated plan from either the government system or frankly the private system in terms of what needs to be done through the rest of this academic year to ensure that children catch up. A survey of rural Jharkhand told us that only 24% of urban children had access to online school and 8% of rural children had access to online school. So it's not just learning loss for those who are on online school, it's a complete learning stop for a large part of India. And as they are reopening schools and walking into schools, we do not have a game plan on what needs to be done in order to ensure that students catch up. And for those that miss 2 years of schooling, to be able to address that huge gap in their schooling life. This is going to play into the big challenge that India will confront 10 years from now when this cohort of students, a whole generation of students, enters the labor market. A labor market which is extremely frayed as a consequence of COVID. CMI data tells us how much the informal economy has been scarred. Salaried workers up to a proportion of nearly 40% reporting that they were now self-employed. This continues to be a trend both in the urban and rural sector. Self-employment in India is not running unicorn entrepreneurs who do IPOs. Self-employment is individuals doing subsistence agriculture or small subsistence forms of livelihood. So the labor market scarring and the loss of education is going to see a significant challenge to India's labor force participation rates. And linked to that is one last point I want to make on this issue, which is the fact that women in India have already been outside of the labor force relative to other countries at similar levels of GDP. And we know from CMI data that female labor has been the first to lose jobs and had the hardest time to re-enter back into the labor market. So again, the long-term scars that we are going to see going over the next decade, for which I don't think we have a battle plan, come from the fact that a generation of students have lost 2 years nearly of schooling. We don't have a battle plan for that. And a large proportion of India's young entrants into the labor market, both in the informal economy and to a degree in the formal salaried economy, are losing jobs. Our recovery has been largely profit-led. It is leading to good profits into the central government treasury. That's a good sign. It raises important questions now for the government of India to decide how it wants to use its revenue bonanza to be able to kickstart, to stimulate which parts of the economy. We have increased capital expenditure significantly over the last year in the hope that it'll have multiplier effects, but there's very little talk or thinking about education and health, which is a second fault line that I want to talk about. So we come to health. As I said, India locked down because India did not trust its public health system. India is not wrong. India's elites, rather, are not wrong not to trust the public health system. It is entirely broken. And most of India's poor, or rather the bulk of India, that is for whom this public health system is supposed to be functional, have actually long given up on the public health system. And they tend often to go either to the private sector or to informal doctors. And there's enough studies on the nature of India's health system to tell us that, in fact, the informal doctor, the Bengali doctor, the quack doctor, whichever way you want to describe them, are an important source of medical care to the bulk of India. Yet, one would have expected that over the course of this last year and a half, and especially against the backdrop of the ravages of April and May 2021, when the second wave hit the country, and even India's elite struggled to find hospital beds. I think the most poignant of these horror stories was of a former diplomat who was waiting in his car outside one of India's most elite hospitals in the city-state of Gurgaon, on the border of my city, Delhi, who passed away in his car waiting for a hospital bed. So no matter who you were, no matter how elite you were, no matter how much access you had, the pressure on the healthcare system in the midst of that second wave meant that most of us suffered, much like most Indians suffer on a fairly regular, relatively day-to-day basis. Have we learned? Well, we haven't done anything visibly to strengthen India's health infrastructure over this last year and a half. In fact, a close look at the budget allocation numbers of 2021-22 in February 2020, when India presented its annual budget, India had also sort of assumed that we had beaten COVID and we were moving forward. Our health expenditure had not ramped up even at all. In fact, in our budget, the government announced a claim of ramping up, and when one looked carefully at the numbers, it was a cobbling together for a large number of pre-existing schemes that gave you a nice number, but didn't do very much in terms of actually expanding the infrastructure of health. But there are three very important contestations around the debate on India's public health system that need to be discussed and debated, all of which were part and parcel of the challenges that we confronted in COVID, and all of which need resolution if we have to genuinely move towards building a robust health system. The first and most important is the role of trust. As I said, we locked down, for the elite, and most of India doesn't go to the public health system in any case because it doesn't necessarily trust the health system. And in the context of COVID, we saw this trust unfold in very, very visible ways. My colleagues and I were part of a small effort with the government of Punjab to try and ramp up testing in the first phase during the first COVID surge. And as an experiment, we went to, we did a pilot survey in a small urban area near the capital of Chandigarh, where we basically gave out free vouchers to citizens to go and test for COVID. And of, I think, 400 vouchers that we gave, 7 people went to test. We went back to try and understand why. It seemed to us puzzling. After all, these were free testing. Wouldn't you want to know, especially given that we had identified people who had very transaction-intensive jobs? And it turned out that that the lack of trust in the state system, the fear that if I test positive, I will be put into an isolation home and the state will abandon me and take me away from my family, was extremely visible in the lives and minds of India. And in fact, while we have achieved quite a significant rate of first vaccines, the real challenge of trust is going to become visible as we get to fully vaccinated and getting to the hard to reach vaccinations, particularly in rural India, where trust in the government system remains a big challenge. And it is perhaps because of that broken trust that many of our policy debates on health are divided very sharply between whether we should go for a provision focused model which invests deeply in the primary health system, or we should go for a managed care focused model, which invests much more in the regulation of health and to some degree in tertiary care and other core public health, rather than focused on primary health. This is a very crucial debate, and you can see it in how governments across the country are prioritizing aspects of investment in health. So the government of India, for instance, has prioritized tertiary care through the insurance program Ayushman Bharat. We are building a national health data structure, all of which to move towards the more US-like managed care sort of model. But it begs the question, and I think COVID highlighted this, that it's really very important for us to be investing in primary care. A related contestation is around the practices of medicine in much of India and the sort of global accepted evidence-based practices. And we saw this play out in the kind of treatment protocols that were evolved in the peak of the second wave. Many argued that Indian doctors were over-medicating and giving medicines like ivermectin and remdesivir that WHO guidelines had suggested otherwise. Many Indian doctors were going on the back of practice and what they were seeing amongst their patients. How do we resolve these questions of evidence standards and local practices in ways that allow for treatment protocols to be devised that are responsive to the realities that governments face today? A third contestation is on center and state, and that brings me to the last fault line that I wanted to talk about. Health is a state subject. Responding to pandemics or epidemics is on the concurrent list. And throughout these last 20 months, we have seen what I call a center-state tug of war that has exposed deep fault lines in India's federal consensus and raised very important questions for fiscal federalism and for the dynamics of center-state relations, our institutional frameworks for responding to these center-state relations going forward, ones that I think will have significant implications for India, both in how we respond to health, but also how we build, or rather, the political contestations that we see around federalism in India today. In 2020 March, we had a national lockdown. Some state governments certainly were moving in the direction of lockdowns. In fact, Delhi, the city-state that I live in, had already announced a 7-day lockdown 2 days prior to the national lockdown. But we saw a very, very robust role being played by the central government. It was the central government and the Prime Minister himself who announced the national lockdown. It was a central government who set up bureaucratic committees, empowered committees of bureaucrats that were supposed to work with state governments. It was a central government that used its fiscal and monetary powers to launch centrally sponsored schemes as part of, or to expand centrally sponsored schemes as part of its relief measures. State governments were desperate, whose revenues had collapsed for those 3 months, were desperately asking the center for more resources. And the center very clearly and carefully chose to ensure that all relief measures were designed through the central government and were not given to states, for whom actually health and social protection, the two critical areas of relief and response, are actually state subjects. So at no point and there was a lot of discussion about whether the central government should be giving block grants to states so that states could design their responses according to their needs. And in fact, to be honest, that was happening. Kerala had a very different response. Maharashtra had a very different response to Delhi, to Bihar, to Uttar Pradesh. So states' health systems are at very different levels of evolution. States' health needs are extremely different. In a diverse and geographically spread country like India, it is on just pure first principles, logical, sensible, rational, and the right thing to do for health to be decentralized, to be a state subject. In fact, I would say even state subject, actually local governments have a much bigger role to play. Yet the entire response was centralized, and it was a central government that decided how we unlock, and it was a central government that would decide what kinds of health measures needed to be put in. And it had huge consequences. So for no effort was made to ensure coordination across states. This was the first time that the globe closed its borders. It was also the first time that Indian states closed their borders. One of the most interesting stories that I think really highlight the challenges that we confronted at the time in April is the critical harvest season in the state of Punjab. But the Indian economy is deeply integrated. Goods and supplies are deeply integrated. Labor, as we saw with the migrant movement, is deeply integrated. We have national markets. One of the things that Punjab farmers need when they are harvesting are gunny sacks. Gunny sacks are made out of jute mills in West Bengal, but jute mills in West Bengal were not tagged as essential services. And therefore, for a good 2 days, Punjab's harvesting, which was crucial for Punjab's economy. And in fact, agriculture is the only sector of the Indian economy that grew in these last 2 years at 3 and 4%. So that harvest was important for us. The whole process of harvesting went into a complete chaos because jute mills were not allowed to function in West Bengal. And there was no institutional system for this to be coordinated. Chief ministers were tweeting to each other. Chief ministers were writing letters to each other. The prime minister's office was being called in a frenzy. Now, eventually problems did get solved, but from an institutional structure, you have to ask, in a country with a deeply integrated economy, and as the economy becomes more sophisticated, that integration is getting even deeper. The absence of mechanisms of coordination that leave chief ministers to play political games on Twitter and empower the prime minister's office to make these coordination decisions is a very serious challenge. We saw this even more acutely in the months of April and May 2021 when the second surge hit. Many cities, Delhi in particular, suffered a significant crisis of oxygen. And our supply of oxygen, medical oxygen, comes from many other states. It needed coordination. Decisions needed to be taken about how to rationalize and allocate medical oxygen supplies across the country, because those few horror-ridden days, which still bring fear in every resident and COVID patient in India, a resident of Delhi and COVID patient in India's minds, given what we went through, there needed to be very careful coordination. States were naturally hoarding their oxygen. Delhi actually has Haryana, Punjab, Rajasthan on our borders. They were not suffering as badly at the time when Delhi was suffering. We could have, had we had good coordination mechanisms, found quick ways of moving oxygen supplies into areas where they were needed on the promise that we would deliver oxygen once our crisis was resolved. One of the things we had learned about COVID is that not every part of the world is hit by COVID at the same time. Surges are spatially concentrated. They peak and trough, and therefore there was need for coordination of medical supplies, including oxygen, medicines, doctors, and so on and so forth. We failed to coordinate because we do not have an institutional mechanism to coordinate, and because we do not think of our public health system as an integrated system, except when it's convenient and there's political credit to be sought when the national government comes in. So many, me included, accused the national government in those very difficult 2 months of completely washing its hands off, saying because it's convenient, health is a state subject. Our vaccination policy suffered in exactly the same way. So one of the most fundamental governance challenges that India faces, which is a key fault line, is this very fundamental 101 public finance question of what level of government should be allocated, what level of function. The basic principle of subsidiarity, that which can be done at the local level should and must be done at the local level, is not followed because of political intersections and a tug of war that gets played out. And believe me, states have played a pretty good game as well. I'm not taking away from states' inability to coordinate with each other, inability to effectively utilize funds available. The government, in fact, increased borrowing limits for states so that the government of India used its powers to increase borrowing limits for states so that they would have access to more resources. States did not fulfill criteria that government of India gave. So in this tug of war about to take place, and the political slugfest finds a new battleground on Twitter, is because we do not have good institutional coordination mechanisms. So the real challenge for India going forward is, as we see a very integrated economy, the need for coordination within a national framework increases. Yet we do not have institutional spaces for these forms of coordination. And as our politics evolves in a way where you are actually beginning to see a very, very central form of political, almost presidential centralization, both at the national government as well as in chief ministerial offices at state government levels, the political maturity to coordinate and build institutions is also lacking. And this is going to be a serious challenge for India's fiscal consensus federal consensus going forward. So 3 big fault lines that COVID exposed for India: the fault line or in the promise of equal citizenship, the fault line in the promise of universal health, the fault line in the promise of India, that is Bharat, is a union of states, a federal, even though we didn't use the word federal in our constitution, essentially a holding together federal country with mechanisms of coordination, exposed in their most bare form through the course of the 20 months. I worry, looking at where the political and policy discourse is today, that we have learned very few lessons. We hope that our ability to get some things done right, including making some progress on vaccination, is taking us to a place where we are probably past the worst of COVID, and we can politically say we fought the COVID battle, COVID is behind us. That as we now go into crucial political elections, we can also say the economy is recovering and is getting more formal, and therefore we don't necessarily have to ask ourselves the most crucial question that COVID presented to us: what should be the right pathway for India to develop a genuinely inclusive economy, one where all Indians are equal participants? The lack of these lessons is evidence of how deeply broken India's social contract is. I'll stop here.
Thank you very much, Yamini, for a very insightful presentation. It is rather direct, and I am afraid it does expose many of the fault lines that we have seen manifest themselves in this last year and a half. But I think you have pointed out some really larger systemic issues that underlie the Indian state, and it's difficult to see how they are going to be resolved in the future. So let me invite the audience to ask questions, and there's 2 ways you could ask a question. One is through a chat, the chat feature on Zoom, or if you could use the raise hand feature on Zoom, I can come to you and ask you. Please do try to, because we will probably be running short of time, try to limit your question in its scope. So please don't make comments, but instead ask pointed questions of Yamini if you could. Meanwhile, as I wait for questions to come in, let me ask you a question, take the prerogative of being the moderator and ask you a question myself. Some of the faults in the Indian system that you pointed out, unequal citizenship, carelessness of the state towards labor, especially migrant labor, some of these have always been around. And yet India's past record at crisis management has actually not been all that bad. If you look at Sen and what Amartya Sen has always said about Indian democracy and why it has sort of has been successfully able to weather crises like famines and floods, is because of the pressure of the media and the social pressure that sort of exerted on governments to act in a situation of immediate crisis. And in the past, the Indian state has been able to rise up to the challenge of crises. This time around, the failure was really quite abject. And so I wonder, was it something really special about COVID, or was it something to do with the particular administration, political administration that we had. I mean, in the United States, we also experience a number of problems that you highlighted in the Indian context. I mean, there was complete lack of coordination between the federal government and the state governments. It was a free for all. There was denial of many aspects of COVID. But a lot of these problems in the US and the US's pathetic response for a developed country to COVID were the result of a particular administration that was in power at that time. So I wanted to ask you the larger question of, do you think how much of this is systemic and how much of it is specific either due to the nature of this crisis or due to the current political administration? Thank you.
Thanks. That's a really important question. I think, so there are three things here. I think the one thing that we should as a nation pat ourselves on the back for is that despite everything, we avoided serious hunger. In the early first 2 weeks of the lockdown, several economists were nervous of or predicting the possibility of food riots across the country. But long-term investment in our public distribution system, despite all its flaws, and despite many very robust arguments that we have had in policy circles over the last decade and more around the need to dismantle the public distribution system, it creates perverse incentives, especially for the farmer. I'm sitting in Delhi, my entire family is hacking away because we can't step out of our house today because the pollution is so bad that your eyes are smarting and throat is racking, all because of the perverse incentives that have created this complex paddy wheat cycle in Punjab and Haryana, and farm fires are burning. But for all those problems, the public distribution system and in fact the National Rural Employment Guarantee Act have the ability and the network to reach, to be expansive, to expand and to contract as needed. And I think that's what helped us avoid extreme hunger. There are surveys to show that food basket compositions have changed. People are skipping meals, but extreme hunger and starvation were avoided through this crisis. And that has to do with historical investment in a certain pillar of our welfare system. And it should be a reminder that these long-term investments, no matter what their flaws, are actually very, very crucial and critical in the uncertain times of the 21st century. We will see other forms of pandemics and climate disasters confronting us. But I think that the overall challenge comes almost entirely from the nature of our politics of today and what we as a society are demanding, and that of course feeds into politics. So what did we do? Our media is not free to report. Our public sphere is extremely polarized. You're either with us or against us. You cannot have a nuanced conversation like this. I mean, none of what I'm saying today is about smearing any political party. It is about a reality that we confront as a citizenry. We need to be able to talk about it. But I will be branded as being anti-national and political for having expressed the views that I have. In that context, what was our media reporting? So I looked at it, I don't know, Anil, if you may recall, or our Indian colleagues here will certainly remember that in the early part of the lockdown, and this happened very close to where I live here in Delhi, there was a incident where it was argued that the Tablighi Jamaat had an event where international participants had come before we closed down borders, and COVID, despite told it wasn't done, and then it was identified as that was the site at which this was a containment zone. The police were out; they had blocked off this entire area where a large Muslim population was. There were 11, according to one study, there 11,000 media are for spreading COVID. Now, if that is the way in which we are reporting about COVID and responding to COVID, you can understand the extent to which those feedback loops that are crucial. In the second wave, the question of reporting of cases, number of deaths, have been very much debated in the policy domain. Several people have been trying to estimate the total number of deaths and trying to understand what actually happened. And yet any attempt to talk about this, within the media or in a nuanced fashion, politically, in Parliament, all get thrown out. And most importantly, Parliament is non-functional. And here I blame across parties. Our politicians were very comfortable with Parliament shutting down. No other country in the world took as long as India did to restart Parliament after the pandemic. The absence of our politicians on the streets across all political parties throughout this phase. In Delhi, after a little bit of cajoling from civil society organizations, there was a whole push to do some feeding in the first and provide relief in the first half of the pandemic, first phase of the pandemic. There was no political mobilization around this. In the second half of the pandemic, an opposition Congress party member as an individual became famous in the city of Delhi for physically going and giving oxygen cylinders to families in distress, trying to help them find beds. There was very little political mobilization around this. So I think the capture of the media and the complete dysfunctionality of the opposition has played a very, very important role in this. And that's also part of the center state fraying that you are seeing, because many opposition government political parties are in government in the states, and the lack of coordination is due to the absence of political maturity on both ends.
Thank you. Thank you so much. That exactly sort of addresses what I was trying to get at. So now we have a question from Rajiv Ranjan.
Yeah. So very good afternoon to all of you. Good evening, good afternoon. And thank you. Am I audible now? Yeah. So thank you, Ms. Yamini Aiyar, for a wonderful presentation. And you covered a broad range of issues, but I will be a little critical here in the sense that we as academicians and maybe as critics of the public leaders, and wherein we can say that public leaders can be from all spheres, say that those who are in actions are not working, but a lot of things happen at a very rapid pace. Say, for example, in COVID-19, things were happening at a very, very rapid pace. Now, it is very easy for us to analyze and say that things are not happening at the pace at which it should happen and things like that. But do we not think that the current economic framework is not sufficient enough? Means that is my question, that there are other economic frameworks which are also being discussed in the academic discipline, and there are other schools of thought. So what are your views on that? Because to substantiate Professor Anil's point, that Amartya Sen once told that academic description is also a choice. So I would like to hear from you whether do you think the current academic frameworks in which we analyze all these things and say that social contracts are missing and social protection is not happening, whether that is sufficient enough to claim that public leaders are not working?
I think that's a really important question. Let me say two things here. I think it is important, and I should correct myself. I should have said this up front, to recognize the huge service of the countless frontline workers in India's health system, from the ASHA worker to the nurses and doctors, both in the government and the private system, the Anganwadi workers, the ANMs, all of whom put themselves personally at great risk to provide support and services to all of us throughout the course of this pandemic. There has been no holiday for government. There has been no work from home for government. They have all been out doing the best that they can. And they are most certainly islands of excellence. Maharashtra, particularly Bombay's municipality and Bombay's municipal commissioner, has been now widely recognized for his robust and rapid response. The state of Kerala, even though Kerala contributes still to amongst the highest numbers of COVID patients, of COVID cases, overall, its health system has shown to be quite robust. And again, across the country, there are large numbers of stories of service, of courage, of passion, of commitment, all of which need to be recognized. I'm responding to the aggregation. And I think that the charge of being critical or overly critical without recognizing the difficulties of decision making, it would have been a fair one that I would have accepted had it not been for the fact that I'm seeing today in November 2021 very little overall recognition of what needs to be done going forward, and that links to the second question that you posed of, what are our frameworks for the Indian economy necessarily robust enough, the right ones for the challenges that we confront. What did we confront through COVID? We learned the informal economy remains extremely vulnerable. By the way, this is not new. The World Bank had estimated, based on our last poverty numbers, that 50% of India is in the vulnerable category, i.e. one income shock away from falling back to poverty. We hadn't moved on thinking about how to build an employment intensive, quality employment based with social security and social safety nets architecture for the Indian state. It's a challenge we always had. When the rubber really hit the road when we faced a national or global crisis, we saw the consequences of that. Where is the debate on that today? It's non-existent. We talk about one nation, one ration card. We're not moving beyond that conversation. The second big challenge, we recognize that the fact that we have invested in, robustly invested in some parts of our social security of the state, actually means that the state can deliver when it needs to. PDS and NREGA are two really good examples of that. Why are we not talking about what needs to be done in our health system? We also recognize that economic growth is deeply intertwined with welfare. In the 1990s, Amartya Sen and Jean Drèze led the charge on this debate of growth versus welfare. A bit of an artifact in some ways, but a very crucial debate that shaped how policymakers were thinking in India. We talked about some amount of inclusive growth in the 2000 phase. Then we moved into the direction of talking about entitlements versus empowerment, of deregulating the economy, and so on and so forth. But we failed to acknowledge front and center that actually investments in welfare, sensible, right investments in welfare, and particularly in human capital, are constitutive of growth. Inequality in India is such a significant challenge. COVID exposed that. We still don't have an appropriate pathway for that. We are willing in our policy discourse to take comfort in the fact that a profit-led growth where the formal economy is doing well, even as the informal economy has been badly scarred, we are comfortable with that, and we are taking no steps even to make the informal economy visible. I have not seen government data telling me what has been the impact on the labor market of the informal economy of COVID. Till today, the PLFS, the Periodic Labor Force Survey, only covers the first 3 months of the national lockdown, April, May, and June, because data was collected in June. We haven't done the census. NSSO data collection also slowed down. So the unwillingness even to recognize the problem is something that I feel is a serious concern. All of which to say, we need to, and when it came to the early part of last year, you will recall that we kept saying we must not let a crisis go. Crises are opportunities. This is the time to reform the Indian economy. What was the direction of our reforms? Labor reforms. Many of those labor reforms that different state governments institutionalized, in fact, went against ILO norms, and they've had to walk back a little bit. Finally, Parliament passed the Social Security Code, but did so with very little debate. Many states have not even reworked the framework of the Social Security codes. So we keep complaining that we need to have factor market liberalization, but we don't have a framework within which we can do that, and we're not moving in that direction. So all these together lead me to feel that, in fact, we are not having the debate we should have in India, which is what will it take for us to build an employment-intensive, human capital economy that has its foundations in human capital, that will ensure that growth percolates to all. I'm not anti-growth. Don't get me wrong. I'm not anti-private investment. I'm not anti-private capital. The question is, how do we ensure that those pathways of growth, in fact, and one last thing that we learned from, which we knew, I think, as academics, but perhaps it did not find its way in the policy discourse as much, is that since 1991, India's growth has led to a lot of divergence among states. The expectation was, if you look at growth trajectories across the globe, that over a period of time, you will see convergence. But now we have the northern part of the country, Bihar, UP in particular, but Odisha, Madhya Pradesh, Jharkhand, Chhattisgarh also contributing, where the economies are so weak that basically remittances play a very important role, and labor moves out towards the west and the south. Now that has huge implications in terms of equity, in terms of regional equality, but also very important in terms of distribution of resources. Right now, all that state governments are doing is to say, we are going to reserve jobs in the private sector for people from our state, Haryana, Jharkhand, Andhra Pradesh. Arvind Kejriwal is trying to expand the Aam Aadmi Party. He made these promises in Goa as well. So we are not going the route of really acknowledging the challenge. Instead, we are saying we'll go native in the hope that we'll be able to provide jobs without asking ourselves, why is it that we have so much regional inequality in India? I'll stop there. Sorry, that's a whole other conversation we need to have.
No, I thank you, Yamini. We have one more question from Namrata Chindarkar, and that is, what is the alternative to cooperative federalism, particularly in the context of bringing about the urgent reforms needed in health and education that you mentioned? And again, I should mention that we have about 7 minutes left. So, and there's a couple of other questions. So let's see if we can get through those.
I'll be very quick. I don't think there's an alternative to cooperative federalism. And in fact, to the extent that there is an alternative, I would argue for deeper federalism in order to respond to these challenges. I think that these are very, both health and education trajectories and health systems and education systems vary by location. Accountability requires for more local delivery. I think the central government needs to play a coordination role, sharing best practice, providing financial support where it's needed, but leave it to states and local governments to do this right. And states too need to learn that local governments need to be empowered. Without decentralized provision, we will not be able to address the challenges we confront.
Great, thank you. And then we have another question from Rajendra Adhikari, and this is somewhat a long-winded question, so I'm going to try to summarize it. He says, congratulations and many thanks, Dr. Yamini. What you described is exactly what happened in Nepal also. Ministers were distributing oxygen cylinders with their names imprinted in their constituencies. I believe the incidence of poverty also increased dramatically post-pandemic. Thus, referring to all these happenings, would you please present your observation on why such behaviors are demonstrated in countries like India and Nepal, or in South Asia as a whole? I guess that's a rather broad question. But...
Well, to be fair, I would say, we are experiencing these challenges in our context in very sharp ways because of our, we are developing economies. Our state infrastructure is not as robust. And actually, some of our neighbors have done really well, and we should be learning from them. But I think that it would be fair to say that these last 20 months have exposed fissures in state-citizen relations in different ways and forms across the globe. So we're not unusual in that sense. And in the early part of 2020, many of the East Asian countries were celebrated for their ability to control the pandemic. They locked down in very significant ways, used surveillance measures of the most in my opinion, egregious forms, but justified in the name of public health to control the pandemic. But they are now having great difficulty with expanding vaccination. So I think it's a global wake-up call that we need to think very differently about public health. It's also a global wake-up call for regional and multilateral institutions for their inability to be effective. I mean, even the WHO, was prescribing a very, very standardized set of things and not really recognizing the different countries are experiencing the pandemic and responding to the pandemic in very different ways. Pakistan, by the way, my understanding is never really locked down, and to the extent, and there was a big pushback because of its impact on the economy. So it's interesting to ask why, some of our other democracies in the region didn't respond to citizen pressure in the same way, or rather there was no citizen pressure. I think in the Indian case, which I can say with some better understanding, the elite consensus around the lockdown played a very important role.
And to add to that, I should also mention that the response to COVID of a very rich country like the United States, which has presumably one of the best public health infrastructures in the world, was also really quite abysmal. So this is not just a function of South Asian countries being poor and developing countries. This was there were many similarities in the lack of a good response throughout the world. We have one more question from Trilochan Pokhar. My question is, was the poor leadership deliberate, or is it an overall deficit of leadership in our system? How optimistic are you that the problems you have observed will not recur in similar type of crises in the future?
I don't know if it was deliberate necessarily as much as a factor of a function of long recognized deficits in our or long present deficits in our democracy and in our social contract that became exacerbated in a moment of crisis. I will say one thing that worries me. I mean, as I said, I'm not very hopeful of what lessons we have had. We have learned from this effort, from the challenges we've confronted in the last 20 months. But what really worries me is actually how even deeper the democratic deficit is. I mean, just as an observation, I spend a lot of my time going in and out of government offices. And, of course, in the peak of the lockdown, travel has been restricted, movement has been restricted. But after many months, when I finally went to a government office for a meeting, the thing that really struck me in a very harsh way was how silent it was. Usually, at least in India, no matter how broken our democracy is, every single government office across, whether it's at the village panchayat or state secretariats, you see people mingling around because people are coming to try and get, somebody needs a license done. There's a space for people all the time. In fact, to go into a secretariat for a meeting, you have to go through many loops and hoops, and the crowds are huge. So you usually go a good 45 minutes before your meeting to get through all of that. The place was barren. The only people there were government officers. So, in some ways, the physical sites of democracy, the everyday tangible ways in which democracy plays out, which is essentially what has kept at least Indian democracy going despite all the challenges we confront. Those have closed down quite significantly. And it's very quick, after all, across the board, state has monopoly over violence, state has coercive power, state likes to have as much distance from citizens, no matter what politics it plays. That's the nature of the game. It is that's why you have checks and balances. These have shrunk, and it's very easy for this to become the norm. That's what I really worry about in the long term for the health of our democracy and actually for the health of global democracy. We are having the COP right now, and so much of it is being done online. I mean, the physical absence of people to really push and demand, which is what is at the heart of democracy, is something that we need to really ask. And how much of a substitute is this technological interaction is an open question.
Well, on that pessimistic note, unfortunately, Yamini, we will close
People
this.
are resilient. We'll find our way back.
Okay. Well, thank you so much again for a very incisive and a fascinating talk. And so.